So this is a tribally owned casino goes smoke-free. It's a longitudinal study of secondhand smoke and third-hand smoke pollution and exposure. And we have nothing to disclose. So where we actually began in 2005 with this project, and we were originally funded to work on all aspects of secondhand smoke in California and be a statewide advocacy and technical assistance provider. And then we were funded by California Tobacco Control Program through California Department of Public Health, and still are funded through them. And this study was actually co-funded through Tobacco-Related Disease Research Program in California as well. There are 110 federally recognized tribes in California. It's the largest number within any state. And in trying to get our work to begin with tribal nations, it was very difficult. Being a non-native myself, I was constantly being told, there's no way you can work with tribes in California. You have to be tribal to work with California, and you have no clue of where to even begin. And one of the things that really opened up our doors, besides happenstance of meeting Mr. Hayward and connectively, now we can't get away, and we're continuously doing studies, but it was through California Nations Indian Gaming Association and meeting their executive director at the time, who, as I approached him and said, I'm really having trouble trying to find a way in to work with tribal nations. This was 2007, 2008. And he said, when we get back home, we were at a conference in another state, get a hold of me, come meet with me, and I will get you into our group as an associate member. I'll find you a sponsor who has to be tribal, and we'll get you so that you can start working with tribes in California, especially because our work was mainly at that time focusing on casino specific, because tribal casinos are the only place indoors where workers and others can go, and you're exposed to secondhand smoke because smoking's allowed. So for us, it's about commitment. It's about putting in the time and the perseverance, and it's about taking the time to build respectful and meaningful relationships. And I'm sure Mr. Hay would be able to attest that I'm like a bad penny. I just, he thinks I'm going to go away, and then I just keep on coming back again with one more ask. And it's really helped us move our work forward. And in-person versus email, phone, web, the in-person connection is way more meaningful than trying to contact somebody with these other areas. Our study, this particular study, was done in partnership with our wonderful colleagues at San Diego State University. Dr. Jorg Mott kind of took over and put all of the data analysis together, and then also UC Berkeley, who's not on here, but through San Diego State, and then our funders, obviously. But most importantly, the study would not have happened if it were not for Wind River Casino and Reading Rancheria. When we think about engagement and working with tribal nations, as we've heard from many of our previous speakers that have gone before us, it's about respect. It's about respecting traditions and honoring traditions. It's about different health views. It's about the youth, and tribal nations care about their youth. Not that other populations don't, but this is a significant piece of what is going to be left behind for the youth. But also another thing we've seen in California, and I'm sure in many other states as well, a huge uptake in electronic devices and youth. But what we've seen, even in the casino environment, is not just youth. It's the middle age range of between 28 to 50 that are uptaking using e-devices because they feel they're safer than regular cigarettes. And our studies do not cover traditional or healing tobacco. It's completely about tobacco products as we in our society know them, not on tribal lands.
So everybody's still awake? It's getting kind of late in the afternoon, so I'll try to keep you awake. Okay. Real quick, my name's Gary Hayward, and I'm with the Reading Rancheria. I'm actually a tribal member. That's one of my titles. I'm actually the president of the Economic Development Corporation, but the casino is one of our entities. And I've been in the casino business now for 26 years. And when this all started, it was one of those things that where we wanted to know from a health perspective, what was this, how was this impacting our staff? How was this impacting the people that worked there? We weren't necessarily focused on the guests, the patrons, we were focused on the staff. And what were the long-term impacts gonna be from a health perspective? Because we're self-insured. And so there were different aspects to the whole process, but I think the biggest one was that we had to open ourselves up to the fact that we had to work with the local governments first off. And traditionally, we have not had a good experience in the past with that. And so we were a little leery of that, but what we did was we said, hey, look, let's have an agreement here that this is going to be an effort that we do together. This is going to be all of us sharing this information together. And we had basically agreement from the start. We started with the county, and Narendra came into play, and she opened the door for a lot of other resources that made this study even that much better. There is a paper out there that we probably should have put up there for you guys, which we can get out to them, that is published on this study. It's a very intensive one. But it was really awesome to see all the governments and all the different entities, local, state, everybody come together on this process. It was the first of its kind that I know of, at least in California. It was really intensive. We went as far as people were wearing side pack devices to measure the actual impacts of the secondhand smoke in various locations, outside, inside, where do we think the heaviest areas were, and we got that data. And from that data, we actually got to see the reality of what was actually impacting our people within the facility. Like I talked about earlier, the biggest thing was the partnerships. And once you establish those partnerships, the trust comes from that. But until you establish that trust, it's not going to go anywhere. And that was very important because from that, the information that was gathered gave us the ability to make some very educational decisions that have impacted us moving forward and will continue to impact us because we're in the process of expanding again. And when we do our next design, all that information that we gathered over the course of those years will go into that expansion.
So just going back to this slide, so for this study, it was a second-hand and third-hand smoke study. So third-hand smoke, I'm sure, is everyone familiar with third-hand smoke exposure? Okay. So we did 9 data collection visits over a 15-month period. This grant was funded for 2 years. And prior to we kind of left out the whole bit of like adopting a policy and then forgetting the policy and then kind of like figuring it out again. Reading Rancheria adopted a 100% non-smoking policy in their casino in 2014. And it actually stayed in place for 11 months. We couldn't quite make it to the year, and I'm going to let Gary talk about the reasons behind that. Obviously, when we think about all of the studies we do and why it's important to us, sometimes some of us forget that this is also a livelihood, and it has to take care of all of the expenses that come for the tribal members. So this study started right before them implementing the 100% non-smoking policy and collecting finger wipes and paints, wiping the paint on the walls, dust collection in the carpets, finger wipes of the slot machines, and actually cotinine levels as well. So we had individuals that would go in and spend a 4-hour time in the casino and test the urine before and afterwards. And then obviously, this graph that's here is taken from the paper that's been published, and you can find that on our website. And I believe the website is listed at the very end. So what our results were, there were exceptionally high levels of third-hand smoke found in dust and on surfaces. And although the smoking ban led to immediate improvements in air quality, surface nicotine levels were unchanged and remained very high for the first month of the smoking ban. Surface nicotine decreased by 90% after a month. So without doing anything, not changing out carpets, not repainting, not changing ceiling tiles, already within a month there was a 90% decrease in the amount of surface nicotine level. But nicotine and tobacco-specific nitrosamines in dust decreased more slowly, and they were declining by 90%, but after 3 months. It took 3 months for those dust particulate matters to go down. And exposure was significantly reduced after the ban, but the benefits of the ban were reversed after smoking resumed. So after the 11-month period, the non-smoking policy went to 70% of their property as non-smoking, which when we first started with them, it was actually reversed. There was probably 20 to 30% of the property was non-smoking. So that in itself is a huge success when we measure it from where we started to where we are at now, and hopefully moving in the future as they expand. And obviously, this is very short analysis and very short bits and pieces from the conclusions, but long-term smoking in casinos creates deep third-hand smoke reservoirs that persist for months after a smoking ban, and a complete smoking ban immediately improves air quality and significantly reduces exposure to second-hand smoke and third-hand smoke.
Are you going to talk about your favorite picture?
Oh, no, well, yeah, I can do that. Oh, okay. And then third-hand smoke reservoirs contribute to continued low-level exposure to toxicants. And Gary just mentioned the bottom picture. That's a picture as we were doing this study. Actually, we were sitting at an airport and we were flying to a meeting, and he said, hey, I'm going to send you a picture. And he sends me this picture by phone, and I'm looking at it going, what is that? So that is one of the vents.
It's a smoke eater.
Okay, smoke
That's
eater.
what they call it.
Okay, that you call it a smoke eater. This was placed in their bingo hall. Bingo hall was open, was it 2 to 3 times a week?
At the time, 5.
At the time 5.
This
okay.
is a daily cleanout.
Yeah. So that is from being washed out after in the bingo hall there was smoking allowed at the time. So that's all of the residue that was coming off the smoke eater every day.
After a 6-hour session.
Yeah.
Thereabouts.
After 6 hours.
And that was one of about 12. So they all look like that. So when you see that kind of stuff, you should think twice about the smoking, right?
Oh, and then we actually, as some of our previous presenters had talked about materials that are available. So what's really exciting about this study and working with other tribal nations as well, we're working with Sequan Tribal Nation in San Diego, who next spring are going to open up a hotel with a casino floor connected to it, completely non-smoking. So we're very, very excited about that. It'll be a brand new facility that will never have smoking in it, hopefully, and start off that way. And here's a picture of the side pack. I know it was shown earlier, but these kind of infographics are ones that we are allowed to put out with full approval and permission by the tribal nations that we're working with. And unless we're given permission, we do not share data. So that's one thing that we're very mindful of. And even without, when I first met Gary, it was like sign your life away on this document to say you're not going to share anything, right? Literally, because he didn't know any of us. And then, and now it's just I can text any chairman that I'm working with, or Gary in particularly, and say, hey, I've got this presentation. If he can't make it himself, then we're able to share the information. And I think what's critical to that is tribal nations sharing the data collection with other tribal nations are what is going to make a difference and make that change happen, not somebody like me that is not tribal that will say, hey, work with us, please, and here's the reasons why.
I didn't just make this decision, just so you know. I've got 384 constituents, and half of them are kids under the age of 18. But the voting population made this happen. So we did studies with the employees. We did studies with our clinic employees. We did studies with our tribal employees separately. We did tribal surveys as well. From all those surveys, I presented the data to the general council, or the council. The council felt strong enough that it should go. And at the time, the council itself, over 60% of the council were smokers. And they said we should take this to the general membership and see how they feel about it. So we took this to the general membership, and the general membership had made the decision to go smoke-free back in 2014. And in 2014, we were just almost complete, well, we actually had just completed our hotel, And we were about 11 months, like Narendra said, almost a year into it. And if we have a property about 50 miles from us, and I think it would have helped if they kind of went on board with us, because that's where everybody was going. And we were getting ready to have debt service to take care of on the new facility, and we weren't getting the numbers. And I had to make the decision to open it back up. And what we did, though, like she said, when we started, we were about 30% non-smoking. We're currently 70, so we hung on to a lot more non-smoking space than we had when we started, so it wasn't a complete failure. In fact, I think what we got out of it in the future when we expand and build our new facility is we're going to get a lot more from it than we thought we did when we had to turn it back on. But what I thought was interesting was the non-smoking group that started coming never left. So when we turned it back on, they stayed. It was really, really bizarre. I still don't understand that. But they still come, and they still come there. And so I think in the future, I think if we design it right, I think that it will work. We just have to focus on making sure that we apply all the knowledge that we gained from all the studies and everything we did and all the time we put into it, and design it right. But I will tell you this, if anybody tries to tell you that there's a system out there that will take care of it, they're lying. There's no such thing. You can spend millions, billions, I don't care. It could be the next best great thing. If there's smoke in a room, nothing is going, it's so obtrusive, nothing is going to stop that smoke from creeping into everything. It's just what it is. That's all I've got, but thank you.
Are there any questions for Mr. Hayward?
Are you going to maybe try to spread this information? You said you're working with Saquon now. Are you going to spread this information around the state to other tribal casinos?
Yeah, what's kind of cool is we've done some presentations with Cody, the chairman of Saquon, and myself and Narendra have done presentations on what we've done together. And it has opened a lot of people up to asking, hey, how do I do this? How do we get some of this information? So people are starting to call now. People are starting to ask, like, how do I get the information? Because what happens is once you get the information, it's there. You can't look away. And I think some people are like, I don't even want to see it. Because when they see it, they have to deal with it. And I think that we're going to start seeing more of it as we move forward now.
Good, I hope so.
Me too. Yes, sir.
I'm curious to know, did the smoke-free policy affect revenue at all?
It did. Well, it's hard to say because at the time we had just opened the hotel, so we didn't fully get a chance to see how we could move forward with it because there's a lot of programs that come from the gaming revenues. In fact, 90% of the tribe's budget was funded at the time by the gaming proceeds, and I don't think they were willing to take it that much longer because the revenues were down substantially over what we projected. Yeah.
Did you see workforce benefits?
Yeah, I did, and that's another interesting one because one of the biggest complainers we had about going back to smoking was the employees wanted to. Why do you guys think that? Not because they smoked, because their tips were affected. And some of them, people don't realize that 21 dealers and poker dealers and some of the people that work in the slot departments, their tips are very, very big. And so that was impacting their revenues. And that was one of the reasons they were an advocate for going back. Interesting, but that was one of the, we surveyed and that actually came up. Yes, ma'am.
So what about outcomes? Because you say you self-funded from a health perspective, right?
Well, that's our next study. So that's another interesting. I did a presentation. Well, we did a presentation in when was that? Just recently, in October, and a professor from UC San Francisco came up to me, and that's what he does studies on, is the self-insurance and the impacts of what you're doing to affect that internally, and he is actually going to help us. He's going to fund, he has funding for it, and we're going to partner on that, and we're going to do a study on that, because we've been self-insured now for 6 years. So we have some really good data. And we've done some stuff actively to make that to make it better, or to make some of our health issues reduce, like diabetes and some of the things that really impact our tribe. And so I'm looking forward to seeing how that goes. But it's interesting you asked that. We're getting ready to enter into a partnership with them to find that out. I'm really curious because ever since we went self-insured, the savings are just unbelievable by doing that, by managing your own.
And some of the data that was collected during the, I think it was 9 times that you said that was conducted at the facility, were there any numbers that showed a percentage, or just numbers that showed how many people were actually smoking at the time during this the data?
Yeah, that was the other interesting thing. So at our peak times is when we did the measurements. We wanted to know at the busiest times what was the impact, what percentage were smoking. In 2008, and you can correct me, it was about 15%? No, God. See,
It was 10 to 13%.
10 to 13, but then in 2014, we did it again, and it was down to around 9 to 10%. So it had reduced the overall amount of people smoking in there.